stage 3 mesothelioma has spread beyond the pleura or peritoneum to other areas of the body. This means the cancer is considered advanced and more difficult to treat. However, there are still treatment options available that may help control the cancer's growth and potentially extend a patient's lifespan. The treatment plan will depend on various factors like the specific location of the cancer, overall health, medical history, and individual preferences. The main treatment options for stage 3 mesothelioma include chemotherapy. Chemotherapy uses anti-cancer drugs to destroy mesothelioma cells or stop them from spreading. For stage 3 mesothelioma, chemotherapy is usually given systemically through 4 or pills. Some common chemotherapy drugs used include cisplatin, pemetrexed, carboplatin, and gemcitabine. Chemotherapy may be given alone or in combination with other treatments. It can help control symptoms, shrink tumors, and potentially extend survival for some patients. Common side effects include fatigue, nausea, vomiting, hair loss, appetite changes, and increased risk of infection. Radiation therapy. Radiation therapy uses high-energy X-rays or other particles to kill cancer cells or damage their DNA. With stage 3 disease, radiation is usually palliative to treat symptoms from tumors pressing on vital organs or causing pain. It may be used externally with a machine that aims radiation precisely at the tumor or internally via intracavitary radiation where a radioactive source is placed directly into the chest or abdomen through tubes or catheters. Common side effects are fatigue, skin changes at the treatment site, and lung toxicity if large areas of the lung are irradiated. Surgery. Surgery is usually not recommended for stage 3 mesothelioma since the cancer has spread too widely to be fully removed. However, some patients may benefit from tumor debulking surgery to remove parts of the tumor that are causing severe symptoms. This can help provide relief from symptoms like pain, bleeding, or blockage of structures. Surgery is usually combined with other treatments like chemotherapy and radiation. Risks depend on the extent of surgery but can include bleeding, infection, pneumonia, and weakening of the chest wall muscles. Trimodality therapy. This refers to combining chemotherapy, extrapleural pneumonectomy, EPP, surgery, and radiation therapy together as part of a treatment plan. EPP involves removing one entire lung as well as strips of parietal pleural lining the chest wall and diaphragm. It has curative intent but is a complex and risky procedure associated with significant morbidities and mortality risks of around 5 to 10%. It may provide the best chance of long-term survival for some stage 3 patients with good performance status. Targeted drug therapy. Some newer targeted drug therapies have shown promise in treating advanced mesothelioma. These include angiogenesis inhibitors like bevacizumab which prevent tumor blood vessel growth. Immunotherapies like pembrolizumab may help activate the body's immune system to fight cancer cells. Novel chemotherapy agents like pemetrexed or altitrexed in combination with other therapies may provide extra clinical benefits. Ongoing clinical trials are studying these agents' effectiveness in stage 3 disease. Enrolling in a clinical trial, late-stage patients who do not respond well to standard treatments or are unable to tolerate aggressive therapies may consider participating in a clinical trial evaluating new treatments or combination regimens. Trials look at new drugs or experimental therapies that have shown promise in treating mesothelioma. This helps advance the field and gives patients early access to potentially beneficial investigational treatments. Palliative care. Palliative treatments focus on relieving symptoms and improving quality of life rather than cure. They are important at any stage and can be used with curative therapies or alone to enhance comfort. Options include medications for pain, shortness of breath, blood clots, nutritional support. Pleural effusions or ascites can be drained. Radiation may help control tumor sites causing specific issues. Palliative surgery can relieve bowel or other obstructions. Psychological support helps manage stress or end-of-life goals of care discussions. Stage 3 mesothelioma requires aggressive treatment, but some multimodal options may still provide benefits when used under guidance of a specialist. Participation in clinical trials should also be considered. Overall, the goals shift to improving symptoms and quality of life rather than cure at this stage. A treatment plan is tailored based on individual factors, goals, and tolerability of interventions. Early discussion with mesothelioma doctors ensures all options are explored